Glucose regulation happens automatically and constantly in the body all day long. Normal blood glucose level should be between 60 and 140 mg per deciliter for the body cells to have enough energy. Although brain cells do not require insulin to transport glucose into neurons, sufficient quantities must be available. The capillary blood glucose test and the plasma blood glucose test can be performed to detect diabetes by analyzing the amount of glucose in your blood. It is essential to understand what the blood glucose level represents. Blood glucose levels should be between 72 and 99 mg per deciliter when fasting and up to 140 mg per deciliter 2 hours after eating for the vast majority of healthy individuals. In addition, human blood sugar levels can occasionally exceed 500 mg per deciliter and below 60 mg per deciliter, which is considered abnormally low. These two conditions lead us to today's topic, which is hyperglycemia and hypoglycemia. Hyperglycemia, also known as high blood glucose, occurs when the blood contains an abnormally high sugar level. This happens when either the body is unable to utilize insulin effectively or there is not enough insulin present. The condition is frequently associated with diabetes and can result in severe health complications.
In the mechanism of hyperglycemia, when the blood glucose levels start to rise and exceed the normal level, beta cells of the pancreas release insulin into the bloodstream. The release of insulin enhances the liver and body cells take up glucose and store it as a glycogen by stimulating the liver cells. Due to that, this action inhibits the breakdown of glycogen into glucose and also the conversion of amino acid or fats into glucose in the process of glycogenesis. As a result, the blood glucose level decreases and returns to its set point.
In terms of causation, various factors might contribute to hypoglycemia and hypoglycemia in diabetic patients. For hypoglycemia, it can happen when there is no correct insulin intake, more carbohydrates consumed, less active, and high level of stress.
These are some of the effects of hyperglycemia. Hyperglycemia could lead to overweight, high blood pressure, or known as hypertension, excessive thirst and urination, and blurry vision.
Do you know you can treat or prevent hyperglycemia by exercises, checking blood sugar levels on a regular basis, have a diet eating plan, controlling alcohol intake, and avoid smoking?
Experience problems with their medications, diet, or exercise are most likely to develop the condition. Low blood glucose can occur in people who do not have diabetes.
Hypoglycemia is a mechanism action when blood glucose level falls below the normal level. Alpha cells in the pancreas release glucagon into the blood. In effect, liver cells speed up the breakdown of glycogen into glucose in the process of glycogenesis. Other than that, the conversion of fats and amino acid into glucose also increase. As a result, the blood glucose level rise up and returns to the set point. Two mechanisms of blood glucose regulation, which is hyper and hypoglycemia, have an important role in the action of glucagon and insulin.
While factors that can trigger hypoglycemia are fasting, erratic daily lunch schedule, excessive physical activity without adequate nutrition, and too much insulin intake.
For hypoglycemia, the effects consist of fainting, fatigue, hungry, the skin become pale, and sweating.
To prevent or treat hypoglycemia, if you have diabetes, don't skip or delay meals, measure medication carefully and take it on time, and immediately drink 15 grams of easily digestible carbohydrates right away. And if you don't have diabetes, eat small meals and snacks every few hours and consume a wide range of foods, including protein, fat, and high fiber foods.